Anxiety is a natural response to stress, which can be beneficial in small doses, but can become debilitating when experienced at high levels. It is characterized by feelings of fear, nervousness, and apprehension, which can be accompanied by physical symptoms such as sweating, palpitations, and shortness of breath. Anxiety disorders are a group of mental illnesses that are characterized by persistent and excessive anxiety and fear, which can interfere with daily activities. In this essay, we will explore what anxiety is, the different types of anxiety disorders, their causes, and effective treatment methods. What is anxiety? Anxiety is a natural response to stress, which can help us prepare for potentially dangerous situations. It is a normal and necessary part of life, but when it becomes excessive and prolonged, it can lead to significant distress and interference with daily activities. Anxiety is a feeling of unease, such as worry or fear, which can range from mild to severe. It is often accompanied by physical symptoms such as trembling, sweating, and palpitations. Different types of anxiety disorders. Anxiety disorders are a group of mental illnesses that are characterized by persistent and excessive anxiety and fear, which can interfere with daily activities. There are several types of anxiety disorders, including Generalized anxiety disorder, GAD. This is a chronic condition in which a person experiences excessive anxiety and worry about everyday things, such as work, family, or health, for at least 6 months. Panic disorder. This is characterized by recurrent panic attacks, which are sudden and intense episodes of fear and anxiety. Panic attacks can be accompanied by physical symptoms such as chest pain, palpitations, and shortness of breath. Social anxiety disorder. This is characterized by an intense fear of social situations, such as speaking in public or meeting new people. People with social anxiety disorder may experience physical symptoms such as sweating, blushing, and trembling. Obsessive-compulsive disorder, OCD, this is characterized by intrusive thoughts and repetitive behaviors that are difficult to control. People with OCD may feel compelled to perform certain rituals or routines in order to alleviate their anxiety. Post-traumatic stress disorder, PTSD. This is characterized by recurring flashbacks, nightmares, and intense anxiety following a traumatic event such as a car accident, natural disaster, or military combat. Specific phobias. This is characterized by an intense and irrational fear of specific objects or situations, such as spiders, heights, or flying. Causes of anxiety disorders. The exact causes of anxiety disorders are not fully understood, but research suggests that a combination of genetic, environmental, and psychological factors may play a role. Some of the common risk factors for anxiety disorders include family history. Anxiety disorders tend to run in families, suggesting that genetics may play a role. Brain chemistry. Imbalances in certain neurotransmitters, such as serotonin and dopamine, may contribute to the development of anxiety disorders. Environmental factors. Traumatic life events, such as abuse, neglect, or the death of a loved one, may increase the risk of developing an anxiety disorder. Personality traits. People who are shy, introverted, or have low self-esteem may be more prone to developing anxiety disorders. Medical conditions. Certain medical conditions, such as thyroid disorders and heart disease, may increase the risk of developing anxiety disorders. Treatment for anxiety disorders. Anxiety disorders are treatable, and several effective treatment options are available. The most common treatments for anxiety disorders include cognitive behavioral therapy, CBT. This is a type of therapy that helps people learn to identify and change negative thought patterns and behaviors that contribute to their anxiety. Medications. Several types of medications, such as antidepressants and anti-anxiety drugs, may be prescribed to help alleviate symptoms of anxiety disorders. These medications work by regulating the levels of neurotransmitters in the brain. Exposure therapy. This is a type of therapy that involves gradually exposing a person to the object or situation that triggers their anxiety, in a controlled and safe environment. This can help desensitize them to the anxiety-provoking stimuli and reduce their fear response. Mindfulness-based therapies. This involves teaching people to focus on the present moment and become aware of their thoughts and emotions without judgment. This can help people develop a more positive and accepting attitude towards their anxiety. Relaxation techniques. Techniques such as deep breathing, progressive muscle relaxation, and meditation can help reduce feelings of anxiety and promote relaxation. Lifestyle changes. Making lifestyle changes such as getting regular exercise, eating a healthy diet, getting enough sleep, and avoiding alcohol and drugs can help alleviate symptoms of anxiety disorders. It is important to note that treatment for anxiety disorders is not a one-size-fits-all approach, and what works for one person may not work for another. It is important for individuals with anxiety disorders to work closely with a mental health professional to develop a treatment plan that is tailored to their specific needs. In addition to these treatment options, there are several self-help strategies that people with anxiety disorders can use to manage their symptoms, including educate yourself. Learning about anxiety disorders and understanding the nature of your symptoms can help reduce fear and anxiety. Practice self-care. Taking care of yourself physically, mentally, and emotionally can help reduce feelings of anxiety. This includes getting enough sleep, eating a healthy diet, exercising regularly, and practicing stress-reducing techniques such as meditation and yoga. Join a support group. Joining a support group can provide a sense of community and help individuals with anxiety disorders feel less alone. Avoid triggers. Avoiding situations or stimuli that trigger anxiety can help reduce symptoms. This may involve avoiding certain social situations, limiting caffeine intake, or avoiding stressful situations. Practice positive self-talk. Learning to challenge negative thoughts and replace them with positive affirmations can help reduce feelings of anxiety and promote a more positive outlook. Conclusion. Anxiety is a natural response to stress, but when it becomes excessive and prolonged, it can lead to significant distress and interference with daily activities. Anxiety disorders are a group of mental illnesses that are characterized by persistent and excessive anxiety and fear. The exact causes of anxiety disorders are not fully understood, but research suggests that a combination of genetic, environmental, and psychological factors may play a role. There are several effective treatment options available for anxiety disorders, including cognitive behavioral therapy, medications, exposure therapy, mindfulness-based therapies, relaxation techniques, and lifestyle changes.